And then it's a pleasure for me to say welcome to Francesco Zambon from Italy.
Yes.
That came to Norway on this sunny and summer temperatured day in Levanger.
Absolutely so.
Yes.
Actually, this is one of the reasons I'm very impressed today. So one of the reasons is because of the weather. Because in Venice it's extremely cold and rainy. Instead here it's beautiful summer, so I would have never expected that. But that in the list was actually my last thing for being impressed, because first of all I wanted to congratulate you for the competence of your mayors. I don't know if they're all like the ones that we have just listened, but that's really impressive. I would have never thought that we could hear such a high competence, a specific competence in the fields. And so my best congratulations to you, and I hope that this event is also very widely advertised also through the network of the Healthy Cities, which is very encouraging. And I would also like to say that many of the things that they have said, okay, I didn't understand anything by myself, but through tone, she was kind enough to translate the main points. And what I'm going to say now about Health 2020 is basically what you are already implementing. So once again, Norway is a step ahead. Is a step ahead also for having translated, and I'm very grateful for that, the short and the long version of Health 2020, the policy framework for Europe. Already in Norwegian, I hope that you can take a copy. It's a very nice document with a lot of suggestions and inputs for the next years to come. So, my name is Francesco Zambon. I come from Venice. I'm Italian. I worked for WHO. Before I was working in Russia for 5 years, and recently I moved to the WHO Venice office, which is an office which is focusing specifically on the topic of social determinants of health and health inequities, and between the link between health as a resource for development also. I'm here also to replace Ario Zilio, who is the director of the office, and we have also a video that Ario prepared for this conference. So I'm going to speak about the Health 2020 framework now, and after we will have this video which is more specific on some of the aspects of the Healthy City Network. Maybe this. Yes. So this first slide is about what underpins the entire strategy for Europe, this Health 2020, which I hope you will be using extensively in your language, and that you will hear more about that in the next years to come. It's about the central value that health is something which is instrumental also for achieving many different other benefits. Is essential for granting good economic growth, and it's also important for social cohesion, which we know is very important for keeping communities in very good shape and cohesive. Also, health is an important economic sector in itself. I think that we saw that quite clearly in one of the slides previously, where we saw that the economic sector has a lot of employees, it's a landowner of itself, buildings, and so it's not something that just drains energies and resources, but it's also a main generator of resources, and it's very important for keeping the main assets of the community. And last but not least is the human right concept. So health is a human right, And it's not just something which is at the individual level, but it's also at the community level as a human right. And it's a matter of the state, it's a responsibility of the state to maintain, to protect this human right. And this is also why then there was an unanimous consensus in Malta last September. You know that all the Ministers of Health of the member states of the WHO European region get together once a year for discussing many topics and setting the agenda for the year to come. And last year, the 53 member states which compose the WHO European region gathered in Malta, and I would say that the main point of discussion was this new strategy, and it was endorsed by all the member states. So it means that the countries definitely committed for having this strategy implemented in the next years. So not so many months have passed. It means that the time window for, and also the momentum, the political momentum for taking this policy and trying to apply it at the country level is now, and we are having requests from many member states to help them to support and to implement this strategy. As we will see, it's a strategy which is all focused on improving the population health, so it's very much about public health and about decreasing health inequities. And actually the two things are very much linked, so we can increase the average population of a community only if we at the same time are tackling also the social determinants of health, and we are trying to reduce the inequities, the societal inequities which lead also to the health inequities. And we will go a little bit more into the details of that. But then, why was it necessary to have a new strategy? It was necessary to have a new strategies because there was the time for a response, at least a political framework, a kind of tool which could give some points, starting points for actions to turn the tide, so to say, to counteract this epidemic phenomenon of the health inequities. As we see in this slide, we can see that in the last 30 years, this is the improvement of life expectancy, and we can see that we are doing very well if we are taking the average value for the WHO European region. So life expectancy is increasing, and maybe everyone should be happy about that. But apparently, if we have a look here in the 1970 or 80, that's 80 here, and if you have a look at what happened in 2010, from the equity perspective, it was better the situation in the 1980s. That's quite important message. So overall, the life expectancy is increasing, but not in all the countries, and within the same country also we have very huge differences even within the same city. And this is the line of the CIS countries, so the countries after the collapse of the Soviet Union, where the situation degenerated quite a bit after the collapse itself, for the collapse of the health system. And we see that basically in 30 years, the life expectancy there didn't change at all. Instead, you will see also, this is specifically for Norway, you are doing very well, and it seems that you will live forever actually, because now it's really amazing, but and of course it's great, but if you have a look here, 65, there's like a 15 years gap with countries which are not very far from here. It means that, of course, it's not your responsibility, but you have like huge potentials to share with them. There are lessons here which can be exported to other countries, of course, by tailoring them, because the context is rather different, especially in those countries, but still. This is the aim of also of Health 2020. It's a platform. It's a space where you can share experiences among countries. So one country might be very good in doing some specific thing, and this country might be willing to share that experience with another country which is maybe an expert in another topic or in another field. And it was also needed to have this strategy because of the financial crisis. Financial crisis which is hitting the WHO European region to a different extent in the different countries. Maybe not so much here, but in some countries, especially in the West countries, this is taking a very high toll at the moment. And it's not the case that even The Economist gave some suggestions on how to turn this, to give a very different way for the future in terms of actions which should be taken. And The Economist is actually suggesting to have three main points: to compete more, so to decrease the monopolies, which can be state monopolies or private monopolies, to have targeted interventions, vulnerable groups, which is something that we also heard in the presentation before, and to have like more wide fiscal reform, which are more progressively applying, so that are taking more to those who are richer. It's also very important to focus more, and we will see later on during the presentation, on primary healthcare. And then I think that it's very important that you are speaking about these topics here at the Healthy City Conference, because this is really the level where you can do a lot also for the prevention of non-communicable diseases, which are taking now the highest toll among the diseases in our region. So the situation now is of course very different from the past, and there are many new challenges in our region. We have a demographic challenge. We have people living longer, which is a good thing of course, but we have to try to keep people as healthy as possible for many different reasons, and one of them is also for the economic costs and also for the resources that can be associated with a healthy aging. Then we have different problems with urbanization, and then that can lead to problems with the urban planning if it's not planned for, I mean, we see in some areas where there are these huge cities which are growing without any urban planning, without any space for doing physical activity, or with like fractioning the communities, which are not very good for social cohesion as well. Then we have the huge chapter of non-communicable diseases, and we will go back to that in a second. Maybe it's not a matter that the profile of diseases changed so much. Of course the profile of diseases changed, because now infectious diseases of course are a problem, but not as it was 100 years ago. But what I think changed dramatically is the knowledge that we have at our disposal. So now we know so much more about every disease, and we know how complex it is to interact with them. So the complexity of that is huge, especially for those diseases which are taking the highest burden. Non-communicable diseases, which account for 86% of all the deaths in our region. So we definitely need to do something about that, and we have interventions which can work. Here we can see the different groups for heart diseases, cancer, injuries and violence, but more than this I would like to present the one related to Norway, where again, also for having that life expectancy, of course you are doing well in all major groups of diseases. Probably the only one is this one related to suicide and self-inflicted injuries, which a bit still high, and of course it requires some attention in terms of depression problems and mental health. It's also necessary to have this kind of strategy for the very moment that we are passing now, this economic crisis, which is posing a tremendous threat for raising even further health inequities. We can do something about that in terms of cost-effective interventions. Also because we need to do something about that. If we have a look just at this last part here, road traffic injuries, they account for up to 2%, but it's actually up to 3% of the GDP of a country. That's an incredible amount of money. And these are preventable events. So we're speaking about something which is amenable to prevention. And then you can see obesity-related expenses over 1% of the GDP. So if you sum up all of this, it's like a huge potential saving that you could have if effective interventions which are out there available for implementation would be actually implemented at a larger scale. So it's necessary to identify the problems. We have the solutions for that, but also in these times it's necessary to do the right thing, as we cannot afford to waste money and resources. In this time also we have to face problems like unemployment, which we know is strongly associated with very unfavorable health outcomes in terms of alcohol abuse, in terms of suicide increase. But again, there are also in this field active labor strategies which can be useful, and it's necessary to invest more in social welfare. As we can see here, if we invest in social, you can see here the difference between economic growth per se, which is this part of the slide, which is associated with only 0.11% of reduction in mortality. Instead, if we invest the same amount of money in social welfare spending, then the return will be much higher, because the reduction in mortality would be more than 10 times higher. That's something which is evidence, so that's important to know, and that's important especially for the politicians to have in mind for their long-term plans, because of course this is not something that you would see the day after. Then what are the general principles under Health 2020, under this framework? I would summarize this slide in 4 words. It's up, before, all, and coherence. Up because you need to go up to the roots of the problems. So it's not just acting locally or in the downward streams of the final causes, but you need to go to understand what are the roots of the problem and then to act there at that level. Before, so we need to invest to deal with the prevention of diseases with public health, primary care, health protection, and not so much with the consequences of the diseases. So we need to act before that. All because this is something which involves everyone. All the different sectors, all the different levels, and I guess that we had a wonderful example just before with the mayors involved in doing that, and these are really true public health ministers in a way of the community, and they have to make sure that all the sectors, all the community is involved, also in order to increase the resilience of the community for facing the diseases. And then among all these sectors, among all the policies, there has to be coherence. So it's not possible to have fragmented approaches, or one going in one direction and other going in different directions, sometimes conflicting directions. So it's necessary to rethink a bit at the model that we have been using so far for coordinating also the health sector. So Health 2020 has two main strategic objectives, so only two. One is about improving health and reducing health inequities. And as we said before, these are two things which are strictly linked. In order to achieve population health, to improve population health, you need also to act through the reduction of health inequities. And the other one is about leadership and governance. What do we mean by governance? Governance is about this intersectoral work, about putting people together from the different sectors of society, from the different levels of governments, and aligning all of them towards the same goal. And there are four main priority actions in the strategies. One is about an approach which is a life course approach, so investing also in the very early stages of life and throughout the stages of life, because we know that if we invest more in the youngest, then also the health outcomes will be better in the future. Then we have to tackle the major communicable and non-communicable diseases. There's the part related to the health systems, which should be more patient-centered, and then something which is very important for this very event, the resilience of the community. So act on the community, improve the participation of the people, empower people on their health. And these are all things, but especially the last one, things that can be done at the local level. Health 2020 is not something that comes out of the moon, but it's something that comes after a very long participatory process with the member states. The process started basically the active process 2 years ago because the member states asked for a new framework, like some general guidance which could be applied by the member states in the future, like the general direction for health. So there were many consultations, many different task groups in order to analyze also the evidence and to study the principles which should underpin this strategy. And so we go back to the WHO Constitution, where health is set as a human right. And of course, a lot of importance in this strategy is for primary health care. So ALMA, ATA, and also the Ottawa Charter for Health Promotion, they are all there embedded in this document very nicely. And in order to write this strategy, and you will see in the publication that you have here, especially in the big one, there are many. This is the short version, but there are many supporting documents to that, like pieces of evidence for the main areas of this framework. So something which is related to intervention side, something which is related to the governance. And I wanted to show you the flexibility of this strategy. This is just a framework, but the way it is articulated in the country very much depends on the problem of the country, of course. What are the priorities, the political priorities, the problems, and in this sense, the diversity is really the richness of the region. So within our WHO European region, we have very different countries, but this is also a point of our richness because we have experiences through so many different contexts. We can aim at increasing the knowledge base, also which will be used also for putting forward the strategies and modalities of implementation of this Health 2020 framework. So we are just starting now, but the body of evidence for implementation of Health 2020 will grow in the next years, and so it's something that we are aiming to do also through the many different networks, like local networks, healthy cities, regions for health network, and so on. In addition to this strategy, we have also worked on some specific action plans, like the action plan for non-communicable diseases, which you see here is rather comprehensive, so it goes from the planning side to some specific interventions like salt reduction, marketing, fiscal policies, addressing some of the specific risk factors like tobacco, for instance. Then we have something which is related to active mobility workplace, and something which is more related to the health sector as it is traditionally intended. So the early detection, for instance, of cancer. And in addition to that, we have also other action plans, which are all of them available on the website. This is, for instance, about the 10 essential public health areas. It's a very nice document to improve the capacity in the public health sectors. So there are different areas identified from the monitoring of diseases to whole of government approach, and there are like actions and tools for developing each one of them. So these are all supporting documents to the member states that we are providing, and this is an example again of the non-communicable diseases, which is receiving very little attention at the moment in terms of investment, despite the fact that we know that this is the biggest burden of disease in the region. Still, the investment usually from the health sector budget is only 3%. Then I would like to, before leaving to the video by Aereo, I wanted to show you this slide, which is like an appeal to the minister, but all the different levels of government, so to the mayors and to everyone who has some kind of public function, to take the leadership, to engage more and more in this policy framework, and to make it work as much as possible. Of course, this is at the moment, this is a document, but it has to be to become alive in a way, to be implemented. So we have, from our side, different strategies to implement it in a concrete way. And there are very many suggestions also in the supporting documents of actions that you can take. But we would like to encourage you as much as possible to have a look at this document, and I'm very happy that, again, it's translated in Norwegian. Also because the language sometimes is a bit difficult, so it's better to have it in the own language of the country. To take a look at that, and I'm sure that there are many inputs which you can take. Ideally, by the end of 2020, we should have the entire framework implemented, but I guess that it's just necessary to get started and trying to implement pieces of that. There are many suggestions also for entry points. So if the country is not ready to implement the entire package, then you can choose to focus on a specific topic to show the intersectoral work through that specific topic, and through that then go broader to many different health topics. I would like to show you now the video of Aereo, for which I don't know how to do. So you will also see some images of Venice in its shiny days on the ground.
Good morning. I'm Eric Giger from the European Office of the World Health Organization. I want to bring to you the warm greetings of our office and to all of you, to the mayors, to the city of Verdal and Levanger, to the mayors that are there, the politicians, the experts, people of the civil society. I'm delighted to talk to you about Health 2020. This is a new policy framework that has been endorsed by our 53 member states a few months ago, exactly in September 2012 in March. My job, as agreed with you, is to talk about Health 2020 and show and discuss with you the great relevance of this strategy also for the subnational level of policy making, and in particular of the local level. Basically, in this video, I would like to do three things. First, I would like to spend a few words on the European context, the context in which such a strategy at 2020 should be implemented. Then I will move on to say 2 or 3 key issues related to the implementation of that 2020. And finally, I will share with you 6 lessons that I have personally learned by working with countries both at national and subnational level. So, in English, they say that one image is worth 1,000 words. And in the images that you have in this slide are all images of Europe. Gives you a clear idea that Europe is moving fast. The European context in which health has to be promoted, in a way in which health has to be something that is a resource for everyone, is changing rapidly. And it will depend on our capacity at international, national, and local level to make sense of the images of this slide. If we are able to manage the trends behind these images, probably will create conditions for good health for everyone. If we will be unable to manage such trends, probably we will create conditions for inequities, difficulties for social cohesion, increase of health inequities, etc. Now, the next slide here shows you basically trends related to life expectancy from 1970 up to this day. Well, dear colleagues and friends from Norway, you can see in red the trends of your country, and you should feel quite good that the average situation in Norway is among the very best that we have in Europe and indeed in the world. But you also are aware that the distribution of health, even in a very sophisticated country like Norway, is not equal. And we in WHO are very much impressed, for example, for your new Public Health Act, and from the work that you're doing both at the national and the local level to ensure that you have policies in place that on one hand promote health, and on the other they try to reduce the health gap that we see also within Norwegian society. Now, when we talk about health inequities, basically we're talking about systematic differences between population groups. You can see from the slide that it's not just an issue of the national level, but more and more we can see an increased challenge for health related to health inequities. Also at the macro level, at the city level, at the municipal level. And I'm very sure that the mayors that are in the conference and your Norwegian Health City Network are concerned about that. Because if we increase health inequities, related to that, there are other kind of problems which are related to social security, that are related to local employment, that are related to local housing, that can be related to local social cohesion, etc. As you know, in many European countries, the figure of the mayor is still the figure that is accountable for the health of its citizens. Therefore, I'm very sure that all the mayors that are in the conference are concerned about that. And for sure, like we know with Joe, they want to have health promoted, equity distributed, and very much linked to the local development agenda. I will come back to this. Now, I borrowed this picture from one of your very good Norwegian documents. And to summarize this part, we could say that in Europe, health for some part of the population has become a very complex issue, becoming a challenge. And we want to make sure that in Europe we create better opportunity for people's health and to reduce this health inequity. Allow me now to return very briefly on Health 2020, this new policy framework we have now in Europe. Now, you won't be surprised that at the heart of the strategy, we have a vision that Europe can perform much better in terms of health, can promote better health, and can reduce these health inequities that I've shown to you that are increasing in our continent. The strategy is characterized by two main strategic objectives, as portrayed by this slide. You can see that the first objective is to promote health and reduce health inequities. And the second strategic objective is to increase, to strengthen the governance for health. Now, the governance for health is something that is important at all levels of policy making. And there is a huge challenge, but also a huge opportunity to strengthen the governance for health and the relationship between the health sector and other policy sectors at a very local level. In addition to these two strategic objectives, Health 2020 is characterized by four main priorities, as portrayed by the slide. One would be to invest in health through a life course approach. In other words, here what we talk about is to try to promote health and to support people throughout their life in a very integrated way. The second one is to face public health challenges, for example, the increase of non-communicable diseases. The third priority area is to strengthen the health system and to ensure that the health system are strengthened in a way that will be better able to cope with increased vulnerability that we find in our countries. And the fourth priority area is related to creating sustainable environment for health promotion and resilient society. So, dear Norwegian colleagues, I firmly believe that the first priority, investing in health through a life course approach, and the fourth priority, creating sustainable environment for health promotion and building resilient society, is very, very much in the hands also of the local government. Allow me now to move into my final part of this exchange with you. And what I would like to do now is to share with you 6 general lessons that I personally have learned by working with countries. I'm the head of this office we have in Venice that is dealing with the social determinants of health. And what we try to do is to link health issues and development issues at all levels, from the national level to the sub-national level, would be your county level in Norway, to the local level. So these are 6 lessons that I'm sharing with you, and they really come from my practical work of working with countries. The first lesson, I think that it's time that we put some new questions for ourselves, for the way in which we think about health and we take decisions for health. Now, this slide here proposes 3 new innovative questions for us. It is very key to have a strategic plan for the promotion of health and the reduction of health inequities. So what are the key questions that we should ask ourselves? Our first question is the following one. Where do we produce health in our country, in Norway? In a big city like Oslo, or Bergen, or in smaller towns like the town where you have your conference right now? The second question is, what strategy would deliver the highest equitable health gains for our population? Of course, it would make sense to invest more in those policy areas that gives you the better impact in terms of population health gains. But I would strongly recommend that at the local level, you also look at a third question. The third question, basically, it's what strategy, in addition to answer the first question I mentioned to you, also help to deliver good results in promoting health and in providing added value to local development. So, as you can see here, we're talking about bridging the health agenda with the local development agenda in terms of social development, health development, economic development. I will come back later on to this point. Now, the second lesson is that there is now an urgent need in Europe to strengthen health system to address increased vulnerability. I didn't know exactly what the situation is in Norway, but in an increasing number of our member states, because of the economic crisis, there is an increase of vulnerability in our population, and the health system has to be strengthened in order to give answer to this increased vulnerability. If the system is not able to do that, well, we won't be surprised that health inequity will be from the increase due to these economic difficulties of our countries. The third lesson, as portrayed in the slide, is basically about the need to integrate, to create synergy between different programs and different efforts we have in our field, in the health sector. For example, the time is overdue to ensure that there is better integration, more cooperation between all those programs, technology, human resources that are devoted to reduce risk factors. Risk factors would be, for example, smoking or alcohol abuse, somehow behavior and unhealthy lifestyle, and to create a bridge, a synergy with those institutions and those people that work in the area of reducing risk condition. A risk condition could be poverty, social exclusion, marginalization, stigma. You see, these two areas, very often they don't work together. And we do believe that in the implementation of that 2020, it is a must that all the technology, people, financial resources, infrastructure that works on the risk factors find a way to work closely also with the same kind of infrastructure, technology, and human resources that work in the area of reducing risk conditions. But we also have an increased and fascinating scientific evidence about salutogenic assets that exist in our population. What are they? Salutogenic assets are related to the level of social solidarity in a community, the level of social capital in a community, the distribution of social network in a community, the physical environment. All these are salutogenic factors, are factors that help to promote health and to protect our health. And again, there is a need, and I think the local level is a fantastic setting where we can bring together and to manage not separated intervention or separated programs, but to manage a local strategy where all the work that we do in the risk factors, in the risk condition, and in the maximization of salutogenic assets can come together in terms of an innovative and strong local strategy for the development of health and the reduction of health inequity. Now, the fourth lesson is very much related to the previous one, and is basically the fact that nowadays, because perhaps of the economic crisis, we need to change the typical behavior of policy sector. And this is so true and so important at the local level. We cannot afford that our policy sectors, health, continue to work on its own, separated from where the education sector works, the housing policy sector works, the local energy and transport works, etc. So nowadays it is important that we in the public health find innovative ways to have intersectoral action. We should think in a different way to find an incentive and opportunity to better work with other sectors and to create opportunity for development in other sectors. Now, this slide give you an idea of what we want more and what we want less in terms of how policy sectors behave. I think that in some areas there is a great opportunity to work in terms of integrated budgets. For example, if you work for vulnerable groups, there are at least 4 policy sectors that are absolutely crucial. It will be the health sector, it will be the education sector, it will be the housing sector, and it will be the sector related to job opportunities. Well, there are some innovative experiments now in Europe where there are integrated budgets. So we try somehow to put together budgets from these 4 policy sectors in order to better serve vulnerable population. So these are kind of innovation that, in my view, it's there, and there is no better level than the local level somehow to introduce these new and innovative practices. Now, allow me now to move to the 5th lesson, and it's related to something I just touched upon, related to assets. See, very often we try somehow to look community in terms of their deficit, what doesn't work, the levels of mortality or morbidity, the problems they have. And we try to plan according to these big problems. And that's of course very normal and very rational. But we also think that in order to complement this way of thinking, we also need to look better what actually is working in community, what is good in this community, which kind of assets, salutogenic assets this community have, and try to have a way of planning that on one hand try to minimize the need of the community, and on the other hand try to maximize these assets. In the slide here, basically, what you want to have is to have your communities positioned high in terms of assets and low in terms of need. And this is something that is very, very close to the practical work that we do here in the Venice office in our relationship with countries when countries ask us for technical assistance or capacity building. So, a new way of thinking in terms of planning that in addition to need reduction is also assets maximization. And finally, ladies and gentlemen, allow me now to turn to my final lessons I would like to share with you. Now, the time is now pushing us to completely rethink the way in which our sector, the health sector, is positioned in our society at a national and a local level. And if we think in terms of the local level, what is absolutely a great opportunity we have, and this will be really linked to the implementation of our 2020, is to try to reposition our sector, the health sector, as an integral part of the local development, as a key element of the way in which our countries will try somehow to address the issue of the economic crisis. So we need at the local level to ensure that we are closely to other 2 levels of development, the economic development and social development. So if at the local level we are able to manage health development, social development, economic development, I'm pretty sure that we are going to develop resilient community, sustainable society, and we are able somehow to reconnect people and the community in a much better way that we can see countries are struggling today. So my dear friends from Norway, I hope this reflection could be of some help for you in your discussion, and I wish I could be there with you, and I wish you all best for your work. Many thanks.
A little gift